great pleasure to participate the World Nursing World Conference, and it's also my great pleasure to share what we've done. Today, my topic is a therapeutic play program for children aged 5 to 12 years old, undergoing kidney biopsy with local anesthesia, the development and the feasibility testing. Okay, so a little bit background information about me and my hospital. So I graduated from Fudan University in 2018, and since then I worked in nephrology department, Children's Hospital of Fudan University. And my specialty involves care for children with chronic kidney disease, children on dialysis, and kidney transplantation. So this is where Shanghai is. It is one of the most popular urban cities in the world, and we have 4 children's medical centers in Shanghai. We are one of them. And our hospital is a comprehensive tertiary pediatric hospital. And we are also one of the children's national medical center in China. We have 50 clinical departments and divisions and more than 1,000 beds. Our department was founded in 1954. We have 35 beds and 20 extra beds for hemodialysis. We have 29 nurses in total. We provide outpatient, inpatient care with children from infancy to adolescence. And children visiting our hospital are actually from all over China. Actually, over 75% of families are outside Shanghai. This is our nursing team. We actually do this work together. So the story began with in the real clinic settings. The therapeutic play was newly introduced in our hospital in 2018 to 2019, and a nurse with a therapeutic play training actually helped a boy who was super nervous the day before the kidney biopsy and refused to go to. So that made us wonder how to relieve the scare of children undergoing kidney biopsy with local anesthesia using therapeutic play. So we did some literature review. Kidney biopsy is an invasive procedure, but also very important to perform to diagnose kidney disease. For the standard of practice, it is performed percutaneously with a real-time ultrasound guide. It's a safe procedure regardless to the anesthesia method. In developing countries, around 50 to 90 children were performed under local anesthesia. It is preferred because it is actually less expensive, more easier to prepare, and has less chances of anesthesia-related risks. Well, for children, it could be a source of pain and anxiety. Also, it's very hard for the children who are not able to cooperate. And from the patient's interviews and also the guidelines, there is a need to manage children's distress and improve their cooperation. Therapeutic play is useful in comforting children, and several RCTs have already been conducted in investigating therapeutic play as a preoperative preparation. However, there are great variations in intervention duration, timing, and method, and children undergoing invasive procedure with local anesthesia in inpatient setting is rarely studied. So the research question is for children aged 5 to 12 years old undergoing the kidney biopsy with local anesthesia, what is an effective therapeutic play program to relieve their anxiety before the kidney biopsy and improve their cooperation? Then we got some small fundings to develop a therapeutic play program for children aged 5 to 12 years old undergoing an ultrasound-guided percutaneous native kidney biopsy with local anesthesia, and to test the feasibility of the program. So the method we have 2 phases. For the first one, we conducted a literature review based on Lazarus and Folkman's theory and also Piaget's cognitive development theory. To develop a intervention framework, and based on that, we have a group of people to brainstorm. Then our program. For the next phase, we conducted 4 rounds intervention among 10 children, and we interviewed the children and their caregivers, as well as the nephrologists who performed the procedure to further revise and test the feasibility of our program. So the study was approved by the ethnic board of our hospital. So this is a Lazarus and Folkman's model of stress and coping. So individuals praise stimuli as stressors, and once that happens, it will initiate the coping response, and which could lead to positive or negative outcomes. Pierre's cognitive development and play theory. So the children's cognition happened in a different stage, and for different stage, there were compatible means of play. And this is our intervention framework. Well, kidney disease with local anesthesia was perceived as a stressor, and we want to make the children perceive the stressor as more positive way to add more value to it. And also the biopsy precise procedure could be divided into different stress scenarios. So for each scenarios, we offer education and support to help with the to help them cope better. And this kind of education and support are offered in a way that compatible with their cognitive development. And we hope through that support, the children will have better outcomes, such as with less anxiety, more positive, and less negative emotion, and become more cooperative. So first, we conducted few observations among 5 children undergoing native kidney biopsy with local anesthesia. So we identify the stress scenarios from entering ultrasound room to transferring back to the ward, and also its ideal cooperation behavior. Then we formed an intervention group, including researcher, manager, nurse, social workers, physicians, to brainstorm. Then we developed our important tools for the intervention, including picture books and the kidney biopsy package. And the intervention was conducted a day before kidney biopsy procedure, which namely on Tuesday afternoon, since we only do on each Wednesday. And the intervention was conducted at a quiet room in our department. We considered use the ultrasound room, but it was just too busy for us to use. So the nurse will deliver the intervention to the children, and the intervention lasts around 30 minutes to 1 hour. This is a rundown of our intervention. So for the first section, we have the nurse with a training. She will explain the aim and timing of the intervention. And for one part, we have a 15-page picture book named Renal Biopsy Treasure Hunt for storytelling. So the nurse will read and interact with children. And the kidney biopsy procedure was regarded as a treasure hunt game with 4 levels, and each level or scenario challenge is attendant to the step of the biopsy procedure, which requires children's cooperation. And each level, detailed things were described, and the skills that needed to cooperate with the procedure were practiced. And among the section, some stickers and gifts we also gave to the children to engage them. Another important part is kidney biopsy package. And in this package, we have a lot of gadgets that are clinic available, such as like Q-tips, syringes. So children will get together and perform the stage around each other using these gadgets with the guidance of the nurse. So from those experiences, kind of simulate the experience that happened in the real settings. So you get familiar with the procedure and they understand the coping strategies better. So there are some examples, some actually 6 pages from our whole book. We have a Superman-like figure and also a caterpillar. So the caterpillar is quite important it just makes the story more fun. And also it used in our demonstration and also in the real clinic settings for supporting the children's position. This is what we read the book to them. So this is our cute caterpillar. So after that, from June 2020 to October 2010, eligible children were recruited to explore the feasibility of the program among children and the caregivers, and also we recruited the nephrologist who performed the procedure. And after we conduct the intervention, a descriptive qualitative study was adopted to interview them. So this is data collection. Semi-structured interviews were conducted among 10 children and the caregivers and 4 nephrologists. These are our interview guides. So we basically want to know whether the program is necessary, it could be whether it is beneficial, and what could be improved on. This is the characters of the children and their caregivers that we enrolled. Though the children aged 6 to 12 years old, half of them are female. They had primary or secondary kidney disease. And these are the characters of the nephrologist interviewed. For data analysis, so we recorded interviews and transcribed it within 24 hours, and we manually analyzed the scripts. And Kaliza's method of data analysis was adopted for data interpretation. And the findings, actually we found is quite encouraging, because children and families and the nephrologist all feedback that said that it's necessary to receive this intervention before the kidney biopsy. And they mentioned that although the doctor repeatedly informed the procedure of the biopsy during their rounds, it is still necessary to read the picture book and simulate the procedure. Also, they found that reading the picture books and simulated the experience are highly accepted among children and their caregivers. And children and caregivers are able to understand the content of the picture book and showed a high degree of cooperation in demonstration. They agreed that the intervention were in accordance with the real settings, and they were satisfied with the program. There's a nephrologist, she mentioned that I love the expectation of pain. It's possible duration and it's coping most in this book. It increases the children's and caregivers' trust in physicians and nurses, and the rational expectation is very essential for the cooperation. Definitely there were something could be improved, and there were also some considerations. For example, some family mentioned that the cartoons and videos are probably the better way to show the environment and steps of biopsy, and also probably the children will like it more and could remember the details more. And nephrologists also mentioned there could be, like we could extend the interventions not only before the biopsy, but also during the biopsy procedure. And we can not only focus on children like from 5 to 12 years old, but also above that age. And so the discussion is necessary to have the play program for children undergoing kidney biopsy with local anesthesia, because in some resource-rich settings, like play therapists and specialists will deliver the interventions. While in China, there were really very few like people who qualified, who have the certificate to practice. So basically train the nurse to do the job. And most studies have been conducted in children with general anesthesia, while few, as I mentioned before, invested the relative complicated procedures such as with local anesthesia. And this program was feasible and well accepted in real clinic settings. I think a systematic review was conducted on therapeutic play to prepare children for invasive procedures. And there were great variations in timing method and durations for the intervention. And in our study, a printed book and demonstration package are they're cheap, they're easy to access in clinical settings, and they're well received by the patients, families, and also the physicians. There were some limitations, like there probably be a better way, like videos, VR, AR may be better and very promising training the skills and simulating the procedure. And also interventions could be adopted in waiting areas and also probably in the ultrasound room. The effectiveness of the program is yet to be tested. And the conclusion, the pre-biopsy medical plate program for children undergoing kidney biopsy with local anesthesia was simple, feasible, and well accepted by nephrologist children and their parents. There are some references. I have 2 slides left. Again, I said before, it's my good pleasure to meet everybody on Zoom, but I still prefer face-to-face interaction and connected in real life settings. This is a picture from Shanghai. It is a beautiful city that with a combination of modernity and also tradition. So we hope we can sometimes meet in real life. And if you have any questions or suggestions regarding the research, please feel free to contact me. Thank you.